Labor seems to be gaining some traction on making a bit of a scare campaign about Medicare. Why do you think there is this fertile ground? Is it because of the support of the co-payments in the past, the wanting to privatise the backroom?
Well, look, I would suggest that the reason that we're seeing scare campaigns, and it's not just this scare campaign, we've got many of them running at the moment, is because they just don't have solid policies. And when they put policies out into the marketplace, they get torn down by the experts. And so I think they're resorting to scare campaign tactics, which is really pretty sad because scare campaigns do not make up for good policy. And I believe that the Coalition has got great policy. Our track record in healthcare and in Medicare speaks for itself. In 2012-13, when Labor was last in government, $19 billion spent on Medicare. 10 years later, the Coalition will be spending $31.4 billion on Medicare. And at the same time, we've increased bulk billing rates from 82.2% to 88.8%. You know, nearly 9 out of 10 times somebody goes to a doctor in Australia, they're getting that appointment for free. I mean, that's what speaks to it's speaking to policies, strong policies, and it's a strong economy that allows us to continue to provide these strong investments in things like healthcare.
Anne Ruston, can you rule out any cuts to Medicare?
I can absolutely rule out any cuts.
Why was it so hard to do the other day?
Well, I thought I was quite clear when I said that our track record speaks for itself, as I've just outlined. When I said that we were the government that guaranteed Medicare in legislation, I said quite clearly on Sunday that cuts were ruled out. The Prime Minister then said it again on Monday. I thought I was very clear, but can I be absolutely clear today? There will be no cuts.
Okay, do you accept that going to the doctor has got more expensive under your government?
Well, obviously, there are a number of things that our government has put in place to make sure that healthcare is more affordable for Australians, but also making sure that they've got access to new and interesting and inventive ways to actually access healthcare. I mean, just as an example, over the last 2 years, we've seen telehealth, 100 million telehealth appointments for 17 million Australians. We've now made that universal and permanent feature of our health system. So we will continue to work as a government to make sure that we have an affordable health system. I mean, the 2,900 additional medicines or amended medicines that are now on our PBS also speaks to the affordability of our healthcare system. But you know, I think that our track record shows that we are absolutely committed to making sure that we've got a world-class health system, which I believe we have, and we will continue to improve it in the best interests of Australians.
Your track record isn't great on aged care, though. It's been in a slow demise for the better part of a decade, and still this government has not fixed it after a Royal Commission. Will you be aged care? Will aged care be under your remit as well?
Well, the Prime Minister announced on Sunday that should we be fortunate enough and the Australian public give us the honour of being returned as a government, that I'll be the Minister for Health and Aged Care. But what I would say, Laura, is that we were the ones that called the Royal Commission. We are the ones who've responded to the Royal Commission's findings. We are the ones that have put $18.8 billion on the table to support the recommendations and implement the recommendations of the Royal Commission. Look, we accept that there were a lot of things that were wrong with aged care, but that's what we are addressing at the moment.
You say were, though, that they still exist. There's massive staff shortages. You've been criticised by one of your own in Mike Baird, who's supported Labor's push to have a nurse on staff 24 hours. I mean, is that too much to ask?
We have accepted the recommendation of the Royal Commission for nursing staff to be on premise 24 hours a day, 7 days a week. But we also accepted the Royal Commission's recommendation that it would take us until 2024 to be able to do this in a way that didn't have detrimental and consequential impacts on other areas of the health care sector that rely on our nursing staff. So we are absolutely committed to doing that. In fact, already we've put $3.9 billion against introducing 16-hour nursing staff on site as a transition towards 24-hour, 7-day-a-week care. I mean, the Labor Party came out and made this announcement on the budget reply night and then had to pedal it back. I mean, Mr Dreyfus said that they would have to pause it. Mr Albanese admitted he didn't know where he was going to find the nurses from.
Yeah.
It's all well and good to make these promises, but they must be deliverable. We have been absolutely focused on policy that is deliverable to make sure that we don't make promises that are not able to be delivered.